Welcome to Cracking Cancer, where we tackle the tough questions about cancer with real patients and world experts. Our mission is to empower the cancer community through education, bring transparency to the oncology system, and drive funding for critical cancer research. Whether you're facing a diagnosis, supporting a loved one, or simply here to learn, we're here to bring clarity, hope, and action to the fight against cancer. Hey everyone, welcome to Cracking Cancer. I am your host, Dr. Kyle Concannon. I'm a physician scientist at the University of Colorado, and I am joined today by JJ Singleton and Allison Silberman, and we're talking about cancer in the AYA population. Maybe you both could introduce yourself. We'll start with JJ.
My name is JJ Singleton. I'm from near Asheville, North Carolina. I was diagnosed with colorectal cancer in 2015 at the age of 27.
Hi, I'm Allison Silberman. I'm the CEO of Stupid Cancer, and we are an organization that supports the adolescent and young adult cancer community.
Well, thank you both so much for joining us. I know the incidence of cancer in individuals who are younger seems to be going up. I think that's a real phenomena rather than a phenomena of only increased diagnosis. So I think there are real considerations here that the incidence of cancers are going up, and that means we as a community need to adapt to that. We need to change how we are practicing. We need to change where the research focuses and how we develop community. And I think your group particularly is kind of in the center of that. So maybe before we go to JJ, I want to hear your experience. But Allison, can you describe a little bit what this AYA population is, what that stands for, who's included? We'll start with that.
Sure. So AYA stands for adolescent and young adult, and Stupid Cancer follows the CDC's definition of anyone that's diagnosed with cancer between the ages of 15 and 39. When we talk about our community, we are talking about the patients, the survivors, the caregivers, and all of the professionals that are working to support this community, these patients and survivors. There's nearly 90,000 diagnosed every year in the United States. There's over 2 million AYAs living in survivorship. And as we know, the runway for AYAs is a lot longer than maybe your typical cancer patient who's a little bit older. So the impacts, the physical, the emotional, the societal, the psychosocial impacts of cancer on young people is pretty significant and long lasting. So we are here to support everyone in that space.
Well, so thrilled for the work you do. What made you want to go into this field?
So about almost 20 years ago now, my younger brother was diagnosed with stage 4 Ewing's when he was 24. I, at the time, was working in public service, and it really sort of shifted my perspective on where I wanted to be helpful and most useful, and made the transition into the nonprofit advocacy work. I did some lobbying work in DC for research funding, and then about 7 years ago, this opportunity came along, and it aligns perfectly with my passion, with my experience. And even 20 years later, while the landscape has changed significantly for AYAs, there's still a lot of work to be done.
Yeah. Well, yeah, I can relate to that. I had a brother who also had a rare kind of genetic disorder that prompted me to go into medicine. So those personal connections, I think it's a great way to find meaning in suffering. And at least that's been my sense.
Absolutely.
And JJ, you've walked the walk here. Can you speak a little bit to how old you were when you were diagnosed, what that looked like for you through the lens of someone who was younger and, had the sentiment or the expectation that cancers don't really happen to us at that age? Tell us what happened.
Yeah, I was 27, and with colorectal cancer, I didn't know you could get colorectal cancer at 27 back then. I thought it was something my grandparents had to worry about. So when I got that and living in the area I do, I was the only one I'd ever known in my 20s with cancer. Still to this day, I go to the cancer center. I'm the youngest one in there. So it just changed my outlook. I didn't have really anybody to connect with or to share what I was going through with, because you could try to share it with older cancer patients are there, but their lives are so different than what I'm going through. They've already, found a job, had a family, moved on through those formidable milestones in life. I was just getting ready to start trying to achieve the first or second milestone in my life through when I got sick. And then I just didn't know there was even resources out there back in 2015 for this. I was so caught up into my own cancer. I didn't know where to look, who to reach out to. And it really kind of, I don't want to say set me back, but it put me on the path I am right now, just looking back, going forward through it.
Yeah. I mean, do you think, Allison, that this sense of isolation and not feeling maybe a sense of community with other individuals going through cancer care is common in the AYA population?
Oh, absolutely. And, I think JJ's experience and what he just described is so common within this community that, so many young people are treated in the community setting that are under-resourced or unfamiliar with the needs of AYAs and those unique challenges that young people are going through with cancer. And oftentimes, similar to JJ, they don't see other young people in the waiting rooms or in the infusion centers. And so it feels like, well, why is this me? Why did this happen to me? And, I'm too young for this. And I think that just creates a further isolation and a lot of mental health challenges for young people, because it does feel like you're the only one going through it.
Yeah. Well said. And JJ, what do you think were the actual consequences of the isolation you felt? Like, how did it change your day-to-day life, and how would better community have maybe made that process better?
Yeah, looking back, the isolationism, it caused me to maybe stunt my growth into my life with cancer. I kept everything in. It really damaged my mental health so much too, to where I had to go and, get therapy, because I was having some really dark and scary thoughts about, do I want to keep trying to do this fight if I'm going to be alone and this is going to be the rest of my life? And it kind of sucked all the hope in my outlook to the future back at that time, because I never knew if I was going to connect with somebody my age that was going through cancer. And even when the treatment started working, and I was like, okay, maybe I can look past the age of, 28, 29, 30. Am I going to do this the rest of my life alone? Because I was on incurable treatment, so I have no end date. And it's like I wasn't growing up the same as everybody else I was around, and I had nobody else to relate for that. So that just internally made me isolate more, and my mental health go down until I got help, until I found there was community out there. So I think it just stunted a lot of, my life experiences from 27 to 30, 31. And I'm, still dealing with those today, but doing a lot better today than I was then.
And where have you looked to for community?
It started with, online, just the online communities, and through other organizations like Man Up to Cancer, and then the AYA population in my colorectal cancer spaces. That's how I found Stupid Cancer. And then that's kind of broadened my whole AYA viewpoint and community.
Well, one thing I want to build on that you mentioned is the sensation of just being really lonely and kind of isolated in what you were going through. And I know right now there's a lot of discussion about the male loneliness epidemic is kind of what it's been coined. And I've spoken with, I treat lung cancer, but I've been chatting previously with individuals who treat testicular cancer and cancers that are more kind of skewed toward male, or just more common in males. And they have noticed that individuals come in, they're rarely with someone else, and they can be really withdrawn. They don't want to talk about their symptoms too much. They're just kind of pushing through it. And I guess that's some backstory to Allison. Do you feel like the AYA population of men and women experience their cancers differently? Is there more isolation in men than women? Have you noticed a sex disparity?
Oh, of course. I think if you talk to anyone in nonprofit, there's a sex disparity that, this sort of stigma that women will ask for help and men won't, you kind of see in practice in a lot of our programming. And certainly JJ can speak to this from a personal perspective, which I can't. But, we don't see as many men coming to our programs as we do women. And we've made great strides in that. I'll say the percentage of men that are coming to CancerCon, that are showing up for discussion sessions, has definitely grown from concerted effort. But still, there is that disparity. We have one of the sessions that we do at CancerCon is called our community dialogues, and we have a session that's just for men, and it's a lightly facilitated discussion, a safe space where men can come together and just talk about whatever they want to talk about. And it's funny because when we started doing it, men were a little bit apprehensive about going into a room and talking about their feelings and being with other dudes. And
I refuse to believe it.
Yeah, I know. So we thought it would go over gangbusters, but in truth, it has become this session that a lot of people are really eager to go to. And whenever it's over, there's sort of these cliques of dudes that are walking around CancerCon like we were just in a session together. And it was so great and it was cathartic. And I don't mean to diminish it or make light of it, but it really does sort of speak to that need for safe spaces for a lot of different folks in our community. So I think, yes, I wish I knew what the magic sauce was to have more young men joining our programs. I think there's certainly a little bit of stigma. And then I wonder if some of it is, we're still trying to figure out exactly what people need and how that changes over time. And JJ's an incredible member of our junior board and helping us think through a lot of these bigger questions that we have for AYAs. But, the short answer to your question is yes, 100%.
JJ, why do you think that is? Why do you think that young men are less likely to engage in some of the social supports and community building than young women?
I know for me, it was just breaking those generational expectations of what a man was that I grew up with. I wasn't supposed to talk about my feelings. I wasn't supposed to burden other people with what I was going through. It was, shoulder it, push it down, get through, because you're supposed to be the one everybody else in your family or your community looks to for strength and to be able to get through there. And I know that's very different for different regions and different, families and cultures throughout the country. But I think at the core, a lot of men in a lot of areas are the same. They always have that kind of subconscious expectation of what their dad or their grandpa put down on them because that's how they were raised. That's what they went through. And even though it's a completely different world and society today than it was 20, 30, 50 years ago, we were still brought up that way, even if they were trying to change it. And I think that's a hard thing to break, because even deep down, if you're like my first 2 or 3 years in therapy, I was like, am I even doing the right thing? Because nobody in my family will talk about this. Am I like hurting them, or am I like letting them down because I'm doing this, but I know it's right for myself? And I think that's at the core of it. And then I think it's just every guy is so different, especially like everybody wants to put us in one path and be like, this needs to work here. But I think we just got to find the way to, like, guys in the South, something's going to work for us. It's going to be way different than people in New York City or LA or somewhere like that. So I think we got to just kind of change our mindset of like one path is going to work and learn how to, open up more paths to try.
Yeah. And I well said about how a lot of this is cultural, right? It's people having shared experiences, but, along those lines, you've created this culture, so to speak, around using this AYA terminology to find the shared suffering and then the shared challenges. Allison, what do you think are the unique challenges experienced by AYA patients with cancer?
It just sort of goes back to that time in your life when you're diagnosed. I mean, you think about being an adolescent or young adult and all of these things that you're about to encounter and these milestones like JJ was talking about, whether it's graduating high school or going to prom or starting college. And they're all wonderful and exciting, but they're also really stressful. And then you throw cancer on top, and you're sort of flipping the script on how you're supposed to live your life, right? 17-year-olds aren't supposed to be thinking about their mortality, but now all of a sudden they are. And so everything that you sort of understood to be true about the trajectory of your life has changed. And so those challenges are really just the stress of your milestones exacerbated by something that you weren't planning for or expecting. We think about things like fertility and family planning, right? You usually think about it when you're ready to think about it. And when you have a cancer diagnosis, sometimes you're thrown into that conversation a lot earlier. You may or may not have a partner. You may or may not know if you want to have kids. And so you have to start thinking about it. Your finances, right? Nobody has a savings account for cancer. But now all of a sudden, not only are you sort of entering the financial world and starting to understand savings and, getting your first job, but now you have to figure out how to pay for this really, really expensive treatment. And so all of these different things that are happening in your life they're so much more complicated than they need to be because of cancer. And JJ had touched on this survivor's guilt piece, where your relationships are now changing in ways that you may not be expecting or were planning for. We talk about survivor's guilt as a lot of times with, well, I lost my friend who had cancer and I feel guilty. But there's also a little bit of the burden that I'm putting on my family because I'm sick, or my parents or my friends, that's not really the dynamic, right? My parents are supposed to take care of me. I'm supposed to be an angsty teenager, and that's how it goes. And now all of a sudden you're kind of in this space where you feel badly because you're asking more of the people around you. And that can be, as JJ said, a huge burden on a lot of people.
Yeah, I love how you mentioned that feeling of being a burden on others. We had a different episode, which JJ, I believe, I don't know if you were on the episode with Captain Bill Phillips.
Yes.
Yeah, and he's a captain in the military. He's a fighter pilot, and he didn't tell anyone really in the beginning that he had cancer because he's used to offloading burdens, not unloading burdens, and he felt like he didn't want to be the person bumming people out. He didn't want to be viewed in that way. And so even people that we view as kind of archetypal masculine, he's a fighter pilot in the military who's a captain. Even people like that feel like they're burdening people, and us mortals don't really stand a chance against that kind of feeling, or at least without having some sort of normalization to it. So, Allison, you're mentioning that we have these whole new set of barriers that are worsened really, or made more challenging by a new cancer diagnosis and someone who's going through their typical social developmental milestones, really before you have your feet planted as like an adult individual who's got stuff figured out. And I think one of the challenges is the medical community is not really established for that. When someone comes into the medical oncology office, I'm not doing a great job talking about how your finances are. I'm figuring out what's the next treatment and those kinds of things. What resources do you think are currently available or need to be improved upon to better meet the needs of the AYA population where the healthcare field is lacking?
Yeah, it's an interesting question because we know that healthcare providers are already overtaxed. So I wouldn't want to say, okay, now here, do more to educate your patients or to flag things for your patients. But at the same time, patients don't know what to ask, and they're reeling from a cancer diagnosis. So you don't want to put more burden on them. And we recently did a project. We're in phase 2 of a project where we worked with a bunch of different, a multidisciplinary group of providers through these professional associations like the Oncology Nursing Association, the Hematology Oncology Pharmacy Association, all of these different larger membership organizations to survey their providers to find out how they're working with AYAs and talking about these different topics, whether it's fertility preservation or intimate relationships, or really all of the things. And we asked patients similar questions, and we found that providers are having these conversations, or they feel like they're having these conversations, but patients aren't necessarily receiving the information. There's this gap in communication here. And we need to figure out a way to close the gap that doesn't burden either of those parties any greater than they're already burdened with the work that they have to do and the treatment that they're getting. And some of these conversations are things that you're not trained to do as professionals. Who's talking about palliative care, or who's talking about intimate relationships with your parents in the room. And so we're working with a couple other partners to develop a dual facing tool that both patients and providers can use for shared language and just quick access to resources that they need. There are a multitude of nonprofits out there, Stupid Cancer included, that has all of the resources that AYAs need, that cancer patients need. We just need to make those connections. We're hoping that this project gets a little bit closer to that. But I think a lot of it really comes down to that patient-provider communication and how the language everybody's using and how we're understanding the needs that our patients need and that providers need to be able to share.
Well, and when do you think is maybe the right time for this kind of, I wouldn't want to call it intervention, but if you're going to have somewhat of a cancer boot camp kind of thing, they go in and they learn all these things about, a lot of stuff that is really all happening at once. And even when I'm in the visit with patients, a lot of times I'll stagger how much I talk about in a given visit just because it's a totally new world. It's emotionally shocking, hard time to absorb a ton of info. So yeah, I'm curious when you think the best time to integrate the social considerations that are weaved into a cancer diagnosis is.
I would say early and often. Understanding that once you hear the words "you have cancer," you're not really hearing anything else. But we all know that we learn by repetition, and the more we hear it, the more it might click. And it's not necessarily like, let's sit down and spend an hour talking about fertility preservation, but just this is something we're going to need to think about. This is something we're going to need to talk about, and just continuously having those conversations. Obviously, there are some things that aren't appropriate for, the first conversation, like you're not going to jump right into palliative care, but, maybe it's something that happens a little bit further down the line. But when we're talking about some of these more relationship-based or emotional side effects, there are things that most cancer patients, particularly young people, it's not even on their radar. And so the more we can talk about it and the earlier we can prepare people for it, I think the better served our patients will be.
JJ, is there a particular element that you wish came up earlier for you?
Yeah, I didn't get hardly any of this information. Mine was so quick through diagnosis to surgery and then to treatment there. And then again, I'm such a small community cancer center. I didn't get offered, any information about fertility or preservation or any of that. But I just wish there was more access for me to have information where I could have made the choices there. And again, it's a very complicated issue of when to give these resources out or when to bring them up. And I think, as Allison was saying, just early and often, but in a way that you allow the patient to dictate what they want to know more about, when they want to know it, is like the key, I think, to getting the information to stick and for them to actually use it. Because if you just, dump all the information on there, as you said, like after I got told I had cancer, everything else sounded like Charlie Brown's teacher. Like it was just, nothing was going or sinking in. And there's quite a few appointments that have been like that. So I think it's just finding the right time. And really it's just the access to information so the patient knows it's out there.
Yeah. And sometimes the medical community also isn't great about bringing up the unique challenges for the AY population. The one that comes to mind for me is usually fertility. I treat lung cancer. Lung cancer most commonly happens in individuals who are really past that part of their life. So it's very easy for us to miss having that in our routine for talking about fertility preservation, sperm making, things like that. And many examples, and I'm sure I've probably been guilty of it myself, where people are already on chemotherapy, and then you have the conversation, or you're driven by the urgency of the cancer that these conversations fail to happen. I'm curious your thoughts, JJ. How do you think we should be improving that? And then Allison, I want to hear your thoughts as to how Stupid Cancer may be helping with those types of things.
And yeah, I think those issues should be brought up right at the start. Like as soon as you get the diagnosis, most of the time you're going to be back there in that office within a week or shorter time to start planning everything out. And I would say that is the time to put the information there. And then just to continue, like I did some projects and stuff here. And I'm a really big fan of one-pagers because I don't like reading that much and going into the details. And like even one page, like now everybody checks stuff, on their phone or on their tablet with links that allow the patient to check into there. And I know fertility is different with everybody with the speed they get on the treatment and, where they're at in their journey or the diagnosis. But that has always been my thing. Just give the information out there, make sure the patient knows it, and then allow them to dictate where they want to go. But always reaffirm, be like, have you looked at this? Have you did this? You should check this out. Knowing the timeline, because of course, like me as a patient, I'm going to follow my oncologist's timeline to know when the deadlines are, when I need to make these decisions by.
I think that's a great point that, certainly for some people, it's not an option, right? You have to go right into treatment. But that I think that there's still that responsibility to say, here's what happened. Your treatment had to start immediately. Fertility preservation wasn't an option, but maybe, further on down the line, we can have conversations about family planning. And I think, it's just sort of putting that bug in your ear. To JJ's point, it might not necessarily be like, let's go through a whole encyclopedia of how to deal with relationships, but just to sort of know that this is an impact from your cancer diagnosis, and it might be something you want more support on, and there are resources available. So, that sort of helps combat that isolation. So you're not like, why do I feel like this? I feel weird. Nobody's ever told me I was going to feel like this. And to know that there are places that you can go. It doesn't necessarily have to be a full conversation, but just sort of that, like, just a reminder that things happen when you have cancer and there are places to help you.
Yeah, and I think it's a great point. And even something like, a psychosocial checklist, we don't have anything like that in most oncology clinics. That's saying, are you going through these things? Should we talk about how it's influencing, your academic studies or your relationship with, with whoever, your spouse, kids, your ability to feel like you can be in a relationship. And then, we've struggled in the medical community because the psychosocial support for psychology and those types of resources is spread pretty thin. Right now, I think our oncologic psychology group has a 2-month wait. And, my wait times as a physician, and I'm not as well trained in the psychosocial elements anyway. The wait times are really hard. So I'm wondering, can you speak a little bit to how the community behind Stupid Cancer, other groups, helps meet those disparities, those psychosocial needs?
Sure. Certainly JJ could clarify that a lot better from the patient perspective. But, our goal, again, is to be able to build those connections and create safe spaces for the community to see others who get it, who understand. So we really focus a lot on that peer-to-peer connection, peer-to-peer learning, as well as the educational piece, providing age-appropriate resources. We have a menu of online and in-person programs. All of our programs are really meant to meet people where they're at. So again, we do them both online and in person, knowing that some people can't leave their home, or they can't leave the hospital, or they're just not comfortable walking into a room full of strangers and would rather do it online. But also that being in person, it has a very different feel. And so we have both options. We do meetups, which are just casual gatherings for people to come together. We have discussion sessions, which really lean on expert-led facilitators to present on all of these topics that we've been talking about, as well as facilitate peer-to-peer conversations. We have our stories program where people can just share how they feel, what they went through, whether it's disease-specific or issue-specific or, whatever they're kind of experiencing. And that is there's both catharsis in sharing your story, but also in other people reading the story and seeing like, oh yeah, that was me. I feel the same way. I find connection there. And then of course there's our biggest signature event, our conference, CancerCon, which is coming up at the end of April. And it's 4 days of breakout sessions, general sessions, tons of social activities, but really an opportunity to hear from some of the experts in the AYA space, as well as connect with other AYAs. And so we're really trying to do all of the things because we know that it's a huge community and everybody feels differently and everybody responds differently. And so whatever we can do to meet you where you need to be, we are trying to provide that to bring people in and let them know that you're not alone. And there are other people out there who get it.
JJ, what are some challenges that you think you uniquely encountered being diagnosed at the age you were at, going through the treatments you were on, and what avenues helped you maybe find common ground or feel less isolated, or had some social support to meet those challenges?
Yeah, most of the challenges I faced because of the colorectal cancer diagnosis was just all the information was for elderly people or for people, over the average age of diagnosis, which was around 65. So everything you look up, everything you read about, every pamphlet they gave you, the picture was of an older couple or an older person. It didn't do anything of how the drugs are going to affect your work life. Because most of the time, by the time people were diagnosed, they were already close or going to retire. So even the side effects that I was dealt with, nobody ever told me about how to get through the rest of your life with neuropathy, how it's going to affect what you could do, how it was going to affect how you typed or anything like that. So all those were the issues that I was facing alone because I didn't know there was communities out there of other AYA patients going through cancer, going through learning to live with side effects from the time I was 27. And then when the cancer came back, learning to live life while these side effects were continuing to happen and might never get better. And so just the lack of information, the lack of resources. And then once I found the communities that led me into the larger communities, just having people that understood that and had lived that, we didn't even have to talk about it, or I didn't have to go into details with them. You try to explain neuropathy and how much that hurts your day to a person who's never felt that in their hands. They're like, oh, it's just like your hand's asleep. It goes away in 5 minutes, right? I'm like, no, my hands have been like this for 10 years. But I'd have to explain in detail to them. And somebody else like that I've met in the AYA community who's been through those kind of treatments, you can say one word and they're just, you get it. And that is such a weight lifted off your back that you don't have to relive all the painful days and the painful treatments to try to get somebody to understand why you're like that today, or why your mindset's like that today, or why you're having a hard time getting out of bed that day. And I think that is the biggest thing for me in the AYA community is you find somebody that looks a similar age to me, that's been through the similar life experiences and had their life derailed by cancer, that can understand without me having to go and relive my story every single time I'm trying to tell it or trying to get somebody and tell them how my day is.
Yeah, and I think it's such a great point that our day is a constellation of little things, of little interactions, of tiny things we do, and our arc of the sum of those is what determines quality of life. And I think we do a good job in the medical community of measuring quantity of life and how long someone's under treatment and things like that. But we don't. And we say, the goal of what we do is the longest amount of time at the highest quality of life. But we don't really do a good job in the research world of quantifying and optimizing for quality. And part of that is expectation setting, normalizing, making people feel like they're not alone, the lived experience, So I'm curious from a research perspective, where do you think the research needs are for the AYA population?
I think the research needs are to just continue to evolve what they think of as the AYA population, and that their research goals for them are going to be very different from the research goals of the rest of the cancer population. As you said, like the length of life after treatment is one thing, but the quality of life is a huge thing. And I know it's going to be different because everybody's quality of life is very different. So it's hard to judge that. But also, I think just reshaping what you think of as the research for AYA to not put such an endpoint on something. Because if I can have a good quality of life, in my mind, when I was first diagnosed and I was going through everything, if you could have offered me 3 years where I had a good quality of life versus, 3 years of really hard treatment, then who knows, I would have chose the quality of life just because that was me. And I didn't think that was possible at that point. And I think it's just everybody has a different view of what they want to come into treatment or how, the rest of their life's going to be. So I think just trying not to put everybody, especially AYAs, in like the squared box of this is right. This is what the research is going to do. This is what we're working for. And be like, what does the patient want it to work for?
Sure. Allison, where do you think the biggest area for research need is in the AYA population?
I mean, that's a big question for all the reasons that JJ just said. I think, from a clinical perspective, we don't know so much about the different biologies of the cancers within younger people. There's some research that says within certain diseases, pediatric protocols are better and the lower toxicities are better. But, generally, how do these diseases look different in young people? I think some on the sort of academic research piece, certainly the definition of quality of life is going to change from person to person. And the other consideration that I don't think we're as good at taking into is who plays a part in that quality of life. Certainly the patient is the driver, but the people around them, the caregivers, friends, family, are also a huge part of that. And for an AYA, that caregiver changes over time. It may start off as a parent and then become a roommate or a partner or a spouse or a child. And how do all those different pieces play into what the definition of quality of life is, and how does it change over time? The quality of life for a 16-year-old is probably going to look a lot different than the quality of life for a 35-year-old. This huge age range does certainly bring along a lot of challenges in addressing some of these bigger picture questions. And I think maybe some of it is breaking down those bigger picture questions, because it's not going to be the same for all of us. And there is no one size fits all.
Yeah, it's interesting you mentioned, I am a laboratory-based scientist, so I think a little more in the, molecular landscape. And I've had this conversation with individuals before, because they'll put out research funding, calls for funding and things like that. And I remember being in a large laboratory, and we were talking about a grant that was for, I forgot how they phrased it, but I think it was young lung cancer. And this were some of the top scientists in the world in lung cancer in the room that we're sitting in. And we weren't really sure what that meant. Because it's a social distinction, not always a biologic distinction. Sometimes it's a biologic distinction. But I think there was and it's something we're still kind of figuring out in real time, are there biologic differences in the cancers that come up in individuals who are younger than individuals who are older? And, if there are, what are they? Are they targetable, or are they not targetable? And we just have to be aware of them. But it's interesting, because I think there are individuals who are looking at research progress happening in non-AYA populations. And I want to maybe just emphasize that the progress that we're seeing there often does translate. And I think, JJ, you're probably a great example here, where the medicine that you were on that actually was a result of cutting edge research at the time was studied in colorectal cancer, and it worked really, really well in you. But that's not necessarily, it wasn't evaluated in the beginning as an AYA medicine or studying AYA tumors. So I feel like, at least biologically, we've drawn, or I'm seeing lines being drawn. And I want to emphasize that if research is happening in cancer, generally in one's disease type, and sometimes not even in one's disease type, it really does translate over often. So I guess it's a long-winded way of getting do you feel that the AYA population doesn't feel maybe seen by the research community without being uniquely called out? Or is there a conception that the cancers are biologically distinct? Like, do they feel unseen, I suppose?
I mean, over my 10 years in this, I feel like the AYA population is becoming more seen than I know. I feel more seen now than I did 10 years ago with the treatments. And now that I'm do a lot more work in the clinical trial space and, both on the, NCI side and the pharma side, I am seeing more directly, directed trials and stuff to AYA, age groups. And that's from everything from drugs, but mainly to the, dosage and how the length of treatment there. So I think that's like one of the biggest things. Like there are more emphasis there, and that's kind of like my hope that it just keeps growing like that and keeps evolving. But in short answer, I do think we feel more seen, but there's still a long way to go.
Well, I think that's a great point, particularly with if you have a cancer type that tends to happen in older individuals, colorectal cancer, lung cancer. A lot of times you are limited, or you can be limited by the dose of something, how aggressive you're going to be. And that limitation may be true in the median or the average age individual whose body has experienced more and they're less resilient. Whereas the body who has only experienced 20 years of life, 25, we don't do a good job of parsing that out clinically. And I haven't seen a lot of trials that specifically call that out and carve out individuals who are younger, who may be a little more physically robust and can handle, who can handle higher doses, who can handle being pushed a little harder. Yeah, that's a great point. Allison, what do you think?
I think, AYA is certainly more in our conversation now. I don't want to say it's having a moment, because I hope it's not just a moment. But we are, we're seeing a lot more in the news about colorectal cancers and, older cancers in younger people. And so I think there's a little bit more focus on it now than there used to be, which is great, which is right what we want to see happen. And I think we need to, right now, if you're an AYA, how you get treated really depends on where you land. And I don't just mean between the community setting and the academic setting. I mean, I can use the example of my brother, who was treated at two of the best academic centers in this country. And he was on completely different floors. He was an adult in one, he was a pediatric in the other. And I'm not advocating for standardizing what an AYA is across, right? Like every person is different, every disease is different, but it does feel we're sort of moving at warp speed with AYAs, and we need to sort of figure out what it is to be an AYA and how we should approach it, that there needs to be some sort of guideline around that. We have recently advocated on the Hill to have the CDC create some guidelines around what it means to be an AYA and what services AYAs need to have, wherever they're treated. So I think, we're moving in the right direction. I don't want us to sort of throw everything at the wall and then figure it out when it's there, but let's be a little bit more thoughtful about it as we start to recognize AYA as a unique entity.
Well, and it's interesting. You point out something that I hadn't really appreciated before, where you kind of have a few ways to look at it. You have individuals who have a cancer that is often diagnosed in pediatrics, and then they get that older. So you have someone who may be 22 who's usually getting a diagnosis that happens when someone's 8. And that's one situation where someone fits in this AYA category. And then you have to ask, are we using pediatric protocols or are we using adult protocols? And that is very confusing. And I'm, as a clinician, I work in adult cancers. And then we get kind of the opposite question, which is someone is 19 and they're diagnosed with something that usually people are 65. And I think in both areas, you find yourself in this um, Venn diagram of uncertainty, but how, over here you have true pediatricians, and over here you have adult internists, and in the middle is this patient who has a diagnosis that could be treated by either, and the protocols are different. How we push things are different. Yeah, it's an interesting social question, not only from the patient perspective, but also the medical establishment.
Yeah. And also the survivorship piece of it. Certainly the protocols are significant, but again, are you talking to your adult patient about things that you probably wouldn't talk to an 8-year-old about, like fertility?
Right.
So there's, it's certainly inside the hospital, but also the outside of the hospital conversations that can, get lost because they don't fit this mold of what the patient is supposed to be.
Yeah, and I'll say as an adult oncologist, a lot of the social stuff is not as strongly talked about as it would be in a pediatric clinic, where they're, I think, a lot more attuned to that. So if someone's 19 and they're used to people asking about how is this treatment affecting school, affecting your relationship with your parents, those are questions that don't typically come up in the adult oncology clinic. So having some other layer of safety net to make sure that people's subjective experience, their quality of life is adequate, and also the survivorship element. I would say we have survivorship clinic. For us, it usually starts at about 5 years or so, depending on where you're at. But yeah, we don't do the greatest job of, I look at scans, I'm talking about symptoms, the medicines we give are not benign. So a lot of my focus medically is on that, and a lot of it's limited by time. So having these other layers of safety net, like Stupid Cancer and other groups, is I think critical. Where should people go, like pragmatically, if they're looking to learn more about navigating these social challenges? Like, how does Stupid Cancer integrate and help?
Well, our website, stupidcancer.org, has a ton of information, well organized, and resources. So whatever the issue is you want more information on, whether it's relationships or financial planning or fertility, you can find it on our resources. There are questions to ask your healthcare team. There are videos you can watch. There are downloads on there, as well as access to other organizations that might focus just specifically on that. We also have a huge social media presence on Instagram, Facebook, LinkedIn, and TikTok. And we share a lot of information that way too. Whether it's events that we're doing or resources or research projects that you can take part in. And then, of course, we have a newsletter that we send out regularly that you can sign up for on our website. So again, just trying to, get the information out in as many ways as possible so people have easy access to it.
Sure. And JJ, what are some of the things that you found helpful in addition to Stupid Cancer as time continues and kind of in this kind of survivorship mode, or continuing treatments long term?
Yeah, just the connections you make in these kind of groups. So you're not isolating. The big thing with AYA is like most time, if you are with Stupid Cancer in there, most of the time, if you meet somebody there, they're a part of another, advocacy group or another group considered for their specific cancer. Like I do a lot with colorectal cancer, but it's always like, goal driven, purpose driven. We're there to go, with fight colorectal cancer. We just came back from DC because we were big on policy. So we have ASK there. The biggest thing like with Stupid Cancer, and I found there, is it just gives you a community of AYAs that you can just, talk about life with. I mean, you can do that in other groups too, but this isn't so dictated on your specific cancer. It's dictated on you and the age that you are growing up, going through the struggles, the highs, the lows of everything. So just finding that community is, I think, everything as if you're a young adult going through cancer, as you're continuing into, I know a big thing right now, a lot of people are talking about is the survivorship. I can't really speak onto that as, active treatment forever right now. So my survivorship is a lot different than what most of the people are talking about and going through. But it's still, you find those people that you connect with, and through the things that would normally cause you to isolate or maybe spiral, go into depression or anxiety, you have the connections there through groups like Stupid Cancer or even other groups to help you not do that, to help you get through that. So you might spiral, but you might not bottom out every time. And that, I think, that's a positive, and that's a better quality of life as we put it back to there. And like, that's just the biggest thing that I've found that helps through the whole life with cancer, diagnosis, survivorship, this whole kind of space and world that we live in.
And Allison, for the individual who is diagnosed in this AYA age range and they join Stupid Cancer, what are the kind of interactions they can expect to have with their peers?
Well, it's certainly up to them, right? We're not going to make you do anything you don't want to do. But, I think there a couple lower barriers to entry are things like our meetups. We do them once a month online. We do them throughout the country, throughout the year, in person. And it's really up to you how much you want to interact. If you just want to sit on the Zoom call and listen to other people and see other faces and just feel like you're in community, that's fine. If you want to speak up and share your story, if you want to talk about what you ate for dinner, really, it's just about, we're here to create the space and welcome you in when you're ready. If you're just looking to access the resources, that's fine too, or just be aware of what's happening. It's really very much driven by what you're most comfortable with, and we'll make it as comfortable for you as possible. And I think the other thing, and JJ touched on this a little bit, is that we're sort of like the hub of the hub and spoke. We don't do disease-specific work, but we can connect you to people who can. So we do run a collaborative of a lot of other AYA organizations. And if you're looking for something particular, like you want to do advocacy work, or you want a breast cancer organization, or you want to go on an outdoor adventure, we're there to help sort of cultivate that relationship and create that experience.
Wonderful. And JJ, if you could give your younger self or someone who's diagnosed in their early 20s or mid 20s one piece of advice, what would you say?
Don't isolate. Say yes to opportunities, and even if it scares you or makes you anxious, jumping in and joining a community, you never know where that's going to lead and how much it can change your life. Even if when you're diagnosed with cancer, there can be good things that come out of joining a community like that, so you're not alone. I mean, I found my best friend in my life through these communities in there, and my life is completely different because of that. So just say yes and jump in. If you're uncomfortable, you can get out. Nobody's going to force you to, once you join, that you can leave. But I don't think people will once they do, because it is truly life-changing to find a community like that.
Well said. Allison, if you could give someone who's newly diagnosed in their younger years, their AYA years, one piece of advice, what would you give?
I mean, I'd say everything that JJ said. I think most importantly, just know that you're not alone, that there are people out there who get it, and who want to help you navigate, and who want you to help them.
Well said. Well, thank you both for coming on. I really learned a lot from you both about not only the resources out there, but ways I can even reconsider my clinical practice of checklists of things we should be talking about for individuals who are diagnosed in their earlier years. And again, it's stupidcancer.org is where people can go to learn more. And thank you all for listening. If you have additional questions about this podcast or want to pitch other ideas, you can go to CrackingCancer.org and we can see if we can get them on. All right. Bye, everyone.
Thank you.
Thank you.
Thank you for joining us on this episode of Cracking Cancer. If you found this helpful, please like, subscribe, leave us a review, and visit CrackingCancer.org for more information. Every dollar we earn goes directly to furthering the podcast and supporting vital cancer research, because together we can crack cancer.